Okay. So if it's okay with everyone, we're gonna go ahead and get started. So what we're gonna do today, we're gonna start off. So my name's Morgan. I am the lead education editor for the Michigan Journal of Medicine. Want to start off with a big welcome to all of our new reviewers who are joining us. So what we're going to do today, I sent off to the reviewers a recording of the previous session with Dr. Tai, who we have here with us again today, for how to review a research article and the materials that went with that. So what we're going to do, we're going to have our editors-in-chief, Seema and Anuj, go through sort of our process, and then you guys sent in some questions. And so I'm going to read those off to Dr. Taya, and some of them I think could also go to Seema and Anuj as well, sort of about our process. And then we can, if we have additional time, we can open things up to any further questions, okay? Fantastic. And Dr. Taya, I'll reintroduce you after Seema and Anuj have wrapped up their presentation. All right, I'll let our editors-in-chief take it away.
Cool. Well, welcome everybody. My name's Anuj. I'm one of the co-editors-in-chief with Sammy, who's also here on the call. We are really excited that you all are willing to review for us. We think this is a great organization, and really, I was a reviewer of my own 1 year, and it's really great practice and experience for being critical of articles, and will serve you well with your own publications as well. So I just wanted to kind of introduce what our review process is like, so you're all familiar with that. So the way that MJM is structured is we have the editors-in-chief, which are myself and Sammy, and then we have a team of lead editors like Morgan, and then we have editors and then reviewers. So the way the process works when we get an article submitted to our journal is our managing editor, who is Cameron Harder this year, will assign that manuscript to a review team. And that first review team is consistent of one editor and usually 4 reviewers. So that's where you all will come into play. And really it's the job of the editor for that review team to reach out to the reviewers and say, here's a new manuscript. Here's the review form that we're going to be using to review this manuscript. Everybody take a look at it independently. And usually we like to encourage the review team to meet and also discuss the manuscript. What are the strengths, what are the weaknesses? Is this a good fit for our journal? And from there, the editor of that team will kind of compile what the consensus is on that manuscript, and we'll kind of compile all the thoughts, what the strengths and weaknesses are. And it'll go back to our managing editor, and then it'll come to an editor-in-chief, which is myself and Sammy, like I said. And then from there, Sammy and I will look over all the comments in the manuscript itself, and we'll come up with a final decision for the manuscript. And then depending on what that decision is, it'll kind of go back to the authors for revisions usually. That's kind of how our workflow works. And then from there, revisions just come straight back to the editor-in-chief. Usually revisions don't go back to the initial review team. So in terms of, how many reviews you can expect, usually historically in a year of being a reviewer, you should be able to review at least one, possibly more than that if we get more submissions. But in the past couple of years, reviewers can expect to review 1 or 2 manuscripts during their time as a reviewer. Anything I missed in that, Sammy?
The only thing I'll add is that after Dr. Sain's lecture that we had in October, there was a brief 10-minute updates that I provided based on the feedback from reviewers and editors of things that you all want us to change or kind of improve upon to make the process and experience for you as being part of the journal much better. And so from that, you'll be able to, if you go to that second recording that Morgan sent out, there's these slides that go along with it. And I go through the different things that you had noted about that other people might have noted about being enjoyable for being a reviewer editor. I don't know how many of you have yet had the opportunity to be part of a review team, but it might be helpful to see what other people have commented on. The only thing that I will add is that when we were getting the feedback in terms of this workflow that Anuj is talking about, we're going to add in another step where we will share with you the final decision that we do on an article, so you know what we have decided, and also we'll send you a PDF of our comments, because we take that reviewer form that you complete and we kind of we expand it and get much more detailed in the process. So some of our reviews back to people who have submitted manuscripts or articles have been 5 to 6 pages long, single space, with very specific edits, sometimes line by line. And so we want you to see the different level that you can take your review process to. We don't expect you to do that for all of your reviews, but that's what we're doing at like the level for Anuj and myself. And if you want more feedback on your review process to kind of like improve your skills, feel free to follow up with us after submitting your review, and then we can meet with you one-on-one via Zoom or in person and go through that with you. And so I'll encourage you to take a look at those slides, and that is all I had to say there.
All right, fantastic. All right, so next up, I want to reintroduce Dr. Tai. I know you guys probably saw the recording, but just to give a brief abbreviated introduction. So Dr. Tai is an associate professor in internal medicine in the division of gastroenterology with a joint appointment in microbiology and immunology. He's an academic physician scientist at the University of Michigan. He investigates basic molecular biology with research directed at defining how flaviviruses, including hepatitis C virus, dengue, and Zika, interact with their host cell to complete their infection cycle. He's also a staff physician at the VA Ann Arbor healthcare system, caring for veterans with a variety of liver conditions. He has numerous awards and honors, including a Research Scholar Award by the American Gastroenterological Association, Faculty Teaching Award for the Division of Gastroenterology at U of M, and a Young Physician Scientist Award from the American Society for Clinical Investigation. He serves on the editorial board of JCI Insight, as well as clinical and translational gastroenterology. I'm without further ado, I think I'm going to dive into these Q&A questions that you guys sent in for how sort of about reviewing a manuscript, and a couple about, I think, the sort of journal process in general. So thank you so much, Dr. Tai, for being with us tonight. Our first question that we have for you is, what is the most common mistake people make when reviewing a manuscript? And I think actually, I would like to hear Dr. Tai's perspective on this, and possibly our editors-in-chief's perspective on this as well.
Yeah, so I think when you're new reviewers, I think sometimes there's a little bit of also some anxiety about the review process. And I feel like sometimes, at least when I started reviewing, I felt like there was like some pressure on me to kind of be smart and to, to point out things that were wrong in the paper. And I think so. My thing that I think new reviewers sometimes struggle with is that they don't put the manuscript enough in the context of the field. So I think one of the most helpful things you can do as a reviewer is to try to understand, okay, so if the work described here is generally true, how does that contribute to our body of knowledge in this field? Is it something that's truly new, or even if it isn't, does it replicate some important finding in a new population? Or is it, and it could be just replication, but if it's well done, it still might be important. So, put that into context before you dive into the flaws. I think sometimes I see reviews that all go into the flaws, but there might still be a good paper there that underneath all that. So I would, as you write your reviews, kind of think first about what's the significance of this work, if it's true, and if it really has no significance you can identify, then that's obviously a major problem. But that would be my answer to that question.
Anuj and Sammy, do you have anything else to add?
Yeah, I can, from being a reviewer and also being able to see the reviews now, I would agree with, what Dr. Tai said. And I would also say, recognize, I think it's easy to be like super critical as a reviewer. I mean, that's your job to kind of criticize the manuscript and kind of point out what the flaws are, but also recognize that somebody put in a lot of work to that piece and deserves that kind of respect. So like not trying to be out to get them or anything. Encouraging comments are always helpful. And I also wouldn't, some people do get really granular in terms of grammar and sentence structure and things like that. But I will say the majority of the pieces that we get to the Michigan Journal of Medicine, a lot of them are kind of perspective pieces. And in those types of pieces, some of that detail is really important. So saying, this paragraph is like better suited at the beginning of the piece, or you may want to restructure this paragraph and break it into a few main points. So some people, I found that reviewers may think that's too granular in nature, but for those types of perspective pieces, I found it's really valuable.
I had two brief
go
points.
ahead.
One is, sorry, Dr. Tai.
No, go ahead. Go ahead, please. Yeah.
So one is like, we sometimes will get case reports. We don't usually get systematic reviews, but there are national, international guidelines of how to write a case report or how to structure a systematic review, and like Prisma and CARE. And you can simply Google that and that will pop up, and that can help you as a reviewer guide the process of working through an article. The other thing I think is coming back to your article a couple of times. So not just sitting there and doing it all the way through at one time. Take a look at it, do the research that Dr. Tai says in the process, come back to it, look at it more fully, and then I'll even come back to it a third time just to make sure that I'm not missing anything. So even if I do tend to get granular, it's really wanting to give the like feedback that I would hope to get on a paper that I submitted.
Yeah, that's a great point. I actually, that's a great point about not trying to do it all at once. I'll just quickly often skim a paper just to kind of understand what they're trying to do. And then I'll let it kind of percolate in the back of my mind and come back to it maybe, later that day or the next day, and then think about some more then. I forgot to say one more thing, which is, I think this is kind of philosophical again, but it's that sometimes there's the tendency or the temptation to, as a reviewer, to say, well, this is how, and this kind of gets back a little bit on Anuj's comment about, kind of rewriting the paper, but even the bigger picture saying, oh, well, if I had these data, I actually would come to these conclusions. I would take in this direction. And I think it's important as a reviewer not to review the paper in terms of the paper you wish it could be, but evaluate it based on how the authors are presenting it. And so kind of you want to judge it based on what are the authors trying to say, what is their message, what are their key arguments, and judging it on that and not what you wish the paper could be or should be. I know it sounds kind of touchy-feely, but I think there's an important difference there.
Our next question is, in contrast to lab-based studies, how much can be expected in terms of revisions for clinical studies? It's not feasible to retreat groups of patients, and analyses should be predefined, such as the outcome measures, endpoints, et cetera. What is fair game to ask that the authors redo or change?
Yeah, that's great. And actually, Morgan, if you could read the fourth, because I think they're basically, very similar questions, if you wouldn't mind. Or should I read it?
A couple new ones. So yeah, if
okay.
you have
I'll read it. So there's another question that Morgan sent me, which was, should we consider the difficulty of accomplishing our comments when reviewing a manuscript? For example, we feel there's a significant gap in a manuscript, but the experience required would be intensive. How would you navigate that situation? I think those are actually really good questions that that we grapple with all the time at the journals that I edit as well. So what I would say is that as a reviewer, your job is a little bit different from the job of the editors, okay? So I think as a reviewer, your job primarily is to look at, so what are the claims of the authors? And if they're significant, if you think it could add something to the field if they were true, do the data and the analyses adequately support that or not, right? And either they do or they don't. And if they don't, then you're going to suggest the things that absolutely need to be done in order for this for you to find the results plausible, right? Remember, of course, there's never a perfect paper. There's no such thing as a perfect paper. And so the real question in my mind always is, did the authors convince you of what they set out to do, basically? And ultimately, I think the decision on whether or not that's too much work is ultimately going to be up to the editors, ultimately. But I think from a viewer hat, if you're going to say, well, you need to make a new transgenic mouse line, that's obviously not going to be feasible in any kind of realistic time frame. And I did see in a reviewer form that you're asked to recommend a decision. So, I think on that basis, you could reasonably say, look, I recommend rejection because the amount of experiments will be far too intensive for the scope. But ultimately, that really depends on the editors. And if you explain your logic in your reviewer comments, then editors can kind of take those comments and kind of synthesize them and decide, I understand what you're saying, reviewer, but I'm going to overrule you. And in the journals that I edit for, it's not uncommon that we decide to overrule a reviewer who asks for some things that we think are just unreasonable given the scope of what they're asking in the context of the paper. So the first question was, clinical research. Obviously, I think it's a good point that, especially if it's a prospective trial, you're not going to be able to run out there and enroll more patients, right? That's not really feasible. So then it comes down to, well, again, is it really important? Is the study so grossly underpowered that really you just can't believe the data unless you had 100 more subjects? Well, then I think that's important, right? So even if it's not feasible for us to do that, it's still going to be a big problem for you to accept that. And so I think you have to, again, put the required work. You have to decide how much work it would take to make for you to believe what the authors are saying out to do, basically. And based on that, you can decide if that's realistic. And always remembering that the editors are going to have the final say on that. So don't put too much pressure on yourself to make that decision.
I think this actually might segue into another sort of question that I know like journal members have had in the past, which was the question about like major and minor revisions. I know like a lot of times I think about that in terms of like not only effort, but like timeline, because a lot of times those are delivered with a specific timeline. But would you mind talking about the differences there?
Yeah. So I think it sounds like MJM. It sounds like it's going to be accept, right, with no modification, which should be very rare that happens. Minor revision, major revisions, and then flat out reject, right? Those are probably the four. So often at times, as you can imagine, the question is this a major or minor? My personal take on it is that if there are changes but doesn't require any new experiments, doesn't require any major reanalyses of the data, then it should be a minor revision, right? And so there's some issues in terms, maybe the authors overinterpreted something in discussion. They're saying something that really is maybe going a little bit too far beyond the data. And you can say, well, that's to me is a minor revision. Or if it's really a simple thing like, oh, tell me what percentage of your patients had diabetes, that's really easy. That's a minor revision. But if it's going to be, okay, take your data set and I want you to do a new logistic regression based on that, that sounds to me like a major revision, right? So it's going to require significant reanalysis or new work. And in addition, I think what also part of that is saying that if you're asking for a major revision, you're not guaranteeing an acceptance of that revision. They might come back and do some stuff and you might not think it's adequate, or the editors might not think that's enough. Whereas a minor revision should be something where you think the authors should be able to do this very easily, and it'd be very unlikely that they couldn't do this in a rapid time frame. That's how I would look at it. In terms of rejection, coming back in the earlier discussion on how much work is too much, some journals have very explicit rules. Like if you ask for more than, let's say, 3 major things to be done, then maybe it should be a reject, right? So whereas if it's going to be 1 or 2 new experiments or 1 or 2 reanalyses, then that could be a major. So also, I think that's part of the scope, and some journals are very explicit about that nowadays, so that reviewers don't ask for 10 things, 10 major experiments to be redone for a major revision.
Correct me if I'm wrong. My understanding is that there's sort of been like a trend generally in towards, so for major revisions, you sort of think about getting things done in approximately like 3 months, but
Yeah.
it can be extended out a little longer.
Yeah, I think 3 months is pretty realistic. I think for people, I think if you're asking for things that you know will take 6 months, a year, that's unrealistic for most journals and authors. And so I think a 3 month window is reasonable. And authors can always come back and say, look, we think we can do it, but it might take me 4 months. And in most cases, we'll say, of course, that's fine. The other sort of thing sometimes we do every now and then is basically a soft reject. It's something where you think that, look, the paper is interesting, but really the scope of work is pretty extensive, and you're going to say reject, but you'll give a little bit of wiggle room in the letter where the authors want to try again. You'll consider, I don't know if MGM has that, but sometimes we'll write basically a soft reject letter where we'll kind of communicate that we're rejecting it, but if they can do these things and we know that they're kind of big asks, we'll reconsider it. But we're not expecting that either.
So MJM is like, we have generally a pretty soft policy where we try to work with all of our authors to get things into shape. So
great.
Yeah, I'll just kind of comment on that further. Is that historically we've said that we'll not outright reject any submitted paper. We're a journal that's all student run, and we're dedicated to kind of uplifting student work, and here at the University of Michigan. So, I mean, obviously we're not going to publish papers that are not scientifically sound, but even if the list of things that need to be revised is, pages and pages long, we'll still, say resubmit with revisions. So yeah, we are dedicated to kind of helping students bring their work up to a higher level. So we have a policy not to outright reject anything.
Okay, great. Thanks for the clarification.
Okay. So the next question is, when authors resubmit after a review, how often are there points that are unable to be fixed due to study limitations, such as inaccessible data? How do you approach these situations?
Yeah, no, for sure, that's common. I think as a reviewer, sometimes you ask for things, and it is sometimes a bit of a negotiation. And I think in a good editorial decision letter, that letter will have all the reviewer comments, but usually, hopefully, some comment from the editor about what the things the editors really want to see in a revised manuscript. And we try to communicate that, for example, in the editorial letters that we send out for the journals I work at. So that the authors are very clear, okay, there might be, among 4 reviewers, like 15 different things, but the editors really think that 1 or 2 of these things is especially important. But even then, sometimes it's just, for whatever reason, it's technical or it's availability of participants or things like that. It's just not possible. And sometimes authors do come back and they say, look, we can do these things, but not these others, or we did these other things this way, and is that okay? And that's a common situation, which reminds me, as another kind of mistake that reviewers make, is trying to be too prescriptive about how to fix a problem, okay? I think it's appropriate to point a problem out, but I be careful about being too rigid about how you tell the authors to fix it, because they obviously know the area probably best, and they might be able to answer your question without having to do exactly what you think they should do. So I usually try not to be too prescriptive unless it really is like, look, you just need a bigger sample size. Well, there's not much way around that, but sometimes there are ways to address concerns about how experiment is done, or you might suggest that they want to use an orthogonal approach in an experiment because they just use one drug to show this effect. And you don't necessarily have to say, well, you have to use CRISPR, you have to use siRNA, or you have to do anything. So just an example.
And we're running close to the end, but we do have 2 more questions, which I think can be answered pretty shortly. So the first question is for Dr. Tai. Any advice regarding how to best adjust or structure your review process based on whether the article is clinical, translational, or basic sciences?
Yeah, I don't think there should be a lot of difference. I think the philosophy is still the same. Again, what is the value of this work to the field? And then just, what do the data say? How do authors interpret it? And what are the kind of the key issues with the data that you need to be fixed, that you find the interpretation of the authors to be plausible, right? So I actually don't think there needs to be a huge difference in how you philosophically approach it. There's obviously more leeway in doing more experiments rather than getting more, human subjects, as we talked about earlier.
Okay, and then the last question is how many times a year is there an issue published, and what is the best way to get involved and show interest to reviewing papers and being a part of the publication process for our editors-in-chief?
You can take that one, Sammy.
Okay.
I assume if you guys are here that you're already reviewers. So
so we would like to have an issue published once a year. In our contract with Michigan Publishing Services, we're allowed to do up to 2 because it's quite an extensive amount of work just to publish one, and especially with like being students and kind of connecting with MPS so frequently that can be challenging. We have been delayed for a couple of years due to finances, but now we should be set for several years and thus several issues. And we'll anticipate having our 2020 issue coming out at the end of this year. And then technically the 2021 will be in early 2022. And then the 2022 issue will be in late 2022. And hopefully then by 2023, we're kind of back on track. That was a lot of numbers. Check out the newsletter Ramona put together. It's listed there on the last page. And in terms of like getting involved, honestly, coming to the different events that we have scheduled once a month, we track attendance. We look at that when people apply to be editors or editors-in-chief, because it shows that you have an interest and we'll find a way to be committed. And if you can't make it because you are on a rotation, watch the recording, answer the questions, let us know, like follow up. They're required for editors, but they're optional for reviewers. But if you have any interest whatsoever in being an editor, come, explore, and then also email us, because often we have a lot of different side projects going on that we could use a little bit more help on. And it doesn't, just because you're a reviewer, doesn't mean you can't help on those different projects. We would actually really appreciate it if you wanted to. And then outside of that, I didn't have anything. Anuj, did you have anything you wanted to add?
No, I think that's great. And I'll just echo again that generally most of the journal kind of oversight and management happens on the editor-in-chief and lead editor level. But I think it's great if you want to get involved, let us know, because we have a ton of things going on that we could use help with.
And I apologize. There was one last question, which I think I can address like really shortly. It says, how many times can one expect to review a basic science paper? So I looked back at past issues when deciding what sort of article with Dr. Tai for this first header review session. And honestly, there's a pretty wide spread between like basic, translational, and clinical research. So it really, you could get a variety of things. I think there might be a little bit less basic science than clinical and translational, but there still are submissions in that area. All right. Well, those are all of our questions. So it's 6:31. So I want to thank everybody so much for coming. Thank you, Dr. Tai, for spending your evening with us. If you guys have any further questions for myself or editors-in-chief, please email us. I hope that this was useful for you. And thank you everyone for coming.